So I have had the honor of sharing space with several of these upcoming speakers, and this time around, Community Health Needs Assessment, called the CHNA, as Rep. Vega referenced earlier. And I'm thrilled to invite several representatives to now present some of the key findings. It's our hope that we can leverage this information to impact the needs of our community. So first we will hear from the Western Mass Coalition, and immediately following will be Berkshire County. So I ask to join me on the stage, Gail, I'm gonna botch the name, help me out. Grammarosa, Kathleen Szegda, George Gorton, and Molly Goren-Watts.
Good morning, everyone. So I'm Kathleen Szegda. I'm with Partners for a Healthier Community, and I'd like to introduce, we have Molly Goren-Watts, George Gorton, and Gail Grammarosa. And we conducted the Community Health Needs Assessment, or CHNA, as a collaborative, so we're all going to be presenting on different pieces. So we're excited to be here and to share our process and some of the findings from the assessment. So I'm going to turn it over to George.
Good morning. Glad to be here and glad to be able to share the work that we as a coalition have really done to try to understand what impacts the health in the communities that we serve. I work at Shriners Hospitals for Children in Springfield, and we serve all of the 4 counties in western Massachusetts, and it's helpful for us as a healthcare organization to understand what drives health in our community and how we can be responsive to the needs of the community as it affects our health. The Coalition of Western Massachusetts Hospitals is a partnership between 10 nonprofit organizations, hospitals and Health New England in western Massachusetts, including Bay State's Medical Center, Bay State Franklin Medical Center, Bay State Mary Lane Hospital, Bay State Noble Hospital, Bay State Wing Hospital, Cooley Dickinson Hospital, Holyoke Medical Center, Mercy Medical Center, Shriners Hospitals for Children, and Health New England, a local health insurer whose services cover the 4 counties in western Massachusetts. The coalition was initiated in 2012 to gain a better understanding of the needs of the communities that we serve. The coalition shared resources and worked in partnership to identify and better address the health needs of each of the communities through regional community health needs assessments that were performed in 2012 and 2013. The completed community health needs assessments can be found on each of our coalition hospitals' respective websites, and if they're not there already, the 2016 ones will be available shortly. Following a successful CHNA process in 2013, the coalitions continued their partnership and collaboration to complete one in 2016 in partnership with community agencies, which Kathleen and Molly and Gail will talk about in just a few minutes. The CHNA objectives are based on the county health rankings model that you saw just a few minutes ago. It's a model of population health that emphasizes the many different factors which, if we can improve them, can help make our communities healthier places. And the coalition is actively working to identify current and emerging social determinants of health and health behaviors and specific health needs of populations within the coalition hospital service areas. The coalition has recognized mental health services for opioid addiction in particular as a critical priority in western Massachusetts, and we've begun a cooperative effort to share organizational plans and work together rather than separately, not to compete but to collaborate to help make an impact in this area. We meet regularly to discuss this problem and many others, and have made progress on individual and cooperative plans to address the problem of lack of mental health services for people with opioid addiction. A community health needs assessment, which is what you're going to hear about for the next 20 minutes or so, it's a collaborative process. Its intent is to assess, to identify, and to prioritize the top issues in a community that affect our health in collaboration with the community. We can't do it alone. We need to do it in partnership. It is a requirement of the Affordable Care Act for nonprofit agencies such as ourselves, but it is also an opportunity for us to assess needs in partnership with the community to inform the planning and the assessment of needs. Our coalition leverages the resources necessary to identify regional needs and to build a stronger assessment than each of us could accomplish individually, reducing overlap and redundancies and being able to work, again, collaboratively. The Affordable Care Act has a strong emphasis on collaboration, as well as a strong focus on health equity through the social determinants of health framework as it relates to vulnerable populations, which, again, we'll talk about in just a few minutes. And so what we hope to do with this data, to take it sort of to the next steps, is to work in partnership with every one of you to be able to build a coalition that covers Western Massachusetts to change Hampden County and Hampshire County and Franklin County and Berkshire County from 14 to 5 or 4 or 3 or 2 or 1.
Morning. I'm Molly Goren-Watts from the Pioneer Valley Planning Commission, and sorry, I can barely see some of you over this. I need one of those. I think Hillary Clinton actually stood on a little lift on some of hers. But so as George was just talking about, and as we've heard throughout the morning, I think one of the major strengths we have throughout Western Massachusetts is the collaborative nature of all of the people working on equity and public health in this region, and I really appreciate the remarks that so many of you have given about that this morning, and I think George just mentioned that, but that's really, from what I've seen and what I've heard, the collaboration of Western Massachusetts hospitals is really unique, and an amazing strength that we have here is all of these great resources and institutions working together to understand the issues that are going on in our communities and to figure out how to take action on them. So when the Coalition of Western Mass Hospitals put together an RFP to get a consultant to create their community health needs assessments, they really focused on encouraging collaboration. And so Partners for a Healthier Community, the Pioneer Valley Planning Commission, and the Collaborative for Educational Services put together a collaborative response, and that was something that we received feedback that they were very happy about. And again, it's just about all of us taking our skills and resources in the region and working together to fit into how we can best help with our piece of the puzzle. So again, you'll see in the circle on the left here that we had the Coalition of Western Massachusetts Hospitals, and then the consultant team that I just mentioned. And then we also built a group of community stakeholders, and you can see a list here of what I think turned into, in terms of geographically diverse and cross-sector group of people who, together with the consultant team and the Coalition of Hospitals, came together on a regular basis to talk about the process and to give input into the process. So that was the steering committee, and then Kathleen's going to talk a little in a lot more detail about how we performed the needs assessment, and from there developed regional strategies.